American Airlines have sent their planes to Tulsa, Oklahoma. You can see planes are parked everywhere on the taxiway, runways. Their 777, 787, and also 737 MAX were in storage there.
Now, devastated the airline industry. Here is evidence from Sky 9 today. Dozens of Southwest Airlines planes now sit idle at the Southern California Logistics Airport in Victorville. Delta also has several jets parked there. And today, LAX reported air traffic is down about 85% from this time 1 year ago.
Here are some more footage sent in by our viewers all over the world. First, we have Etihad ground their fleet in their Abu Dhabi base, including all the A380s. Next, we move on to Europe, Asia, and South America. The scenes are the same with a lot of airplanes on the ground. The sky is nearing empty. Social distancing is also now happening inside the airplane. A lot of airlines now are allowing passengers to be reseated on board, or at least to be reseated with the gate agent's help to keep a distance from each other. Airlines like Air New Zealand are mandating social distancing on board. The airline is currently amending seat maps and implementing seat restriction to allow customers to spread out where appropriate.
Well, welcome to everyone, and thanks for joining Flight Safety Foundation and our guest panelists on today's webinar. I'm Mark Millam, VP of Tech Programs for Flight Safety Foundation and the organizer for today's event. This webinar is a third in a series where we discuss the crisis impacting the world and the aviation community. Today, we focus on perspectives from medical experts. The foundation is proud to host this event, and we hope it helps us focus on working together towards recovery and safe operations. So let me introduce today's moderator, Dr. Hassan Shahidi, President and CEO from the Flight Safety Foundation. Hassan?
Well, thank you, Mark, and good morning, good afternoon, and good evening. And welcome to our audience who are joining from many time zones around the world. A special greeting and welcome to Flight Safety Foundation members. For those that joined us last 2 weeks on these webinars, welcome back and thank you so much for the feedback. We are incorporating your feedback into our future ones, so please continue to provide us that feedback. The webinars that we've had are now available for viewing on the Flight Safety Foundation YouTube channel. So you can go ahead to the YouTube channel and view those in the event that you missed those webinars. I hope everyone is safe and remains healthy as we try to get through this very difficult period together. Let us at this time take a moment and once again thank the global medical community and health professionals all around the world who are working under extraordinary circumstances with risks to themselves to take care of those that have fallen ill with this terrible virus. We thank them for all that they are doing. We can get through this together and we will prevail. In the last 2 webinars, we discussed the economic and operational impact on aviation. Today, we have a special focus on the medical aspects relating to the impact on COVID-19. And before I introduce our distinguished panel, let me ask Mark to give us some notes and instructions for our plan and platform today.
Yeah, thanks, Hassan. In today's event, like always, we want to encourage your thoughts and questions, so please use the question box on your control panel to submit any of those at any time. As we get to audience questions later in the broadcast, I'll be selecting from the submissions and asking our panelists to respond. There's a couple of us that are monitoring that chat panel for other communication on anything that might not be working for you. and we'll do as well as we can to assist you, but we'll devote our efforts to keeping the broadcast underway with our panelists. The other thing that we'll be doing is some polling. So we have a few polls to share with you today, just to kind of get a sense of who's with us from the audience. And when we get to a polling slide, please go ahead and use a browser or a mobile device and put in the address pollev.com/majorwins156. You can reply on your browser or mobile device, and the entire audience will be able to see the instant results on their webinar screen. So why don't we give that a try right away, and go ahead and make your entries. And as they appear, as you respond, they will appear on our screen. We'll do a few of these today, so we thought it might be good to have you accustomed to giving a try right up front. Looks like somebody's got it figured out already, and others are joining in. Looks like more and more are getting the hang of it. A lot of folks coming in from North America, a few from Europe, even a little bit from South America. And if you didn't get the right location, you can resubmit your response. I saw some Middle East showing up and then got corrected to another region. So thanks for your participation in that poll. In just a moment here, I'm going to lock the responses so we can move on to the next poll. Hopefully, if you didn't get a chance to put a reply in, you'll get a chance on the next poll. But let me forward to the next poll, and you can take a look at this and help us with what kind of stakeholder you represent. You shouldn't have to change anything on your browser, and you can respond to this one rather quickly as well. We've expanded from previous events and tried to put a few more stakeholders in here, as well as a miscellaneous or other category. And it looks like there's quite a few folks that are getting the hang of it. Maybe sometimes you represent more than one stakeholder. So it's okay in this instance to answer more than one category. So it looks like we got some work to do to maybe further define stakeholders, because we got a lot of folks showing up in the other category. That's just fine. But thanks for helping us out so we can sense who our audience is. And I'm going to lock that one so we can kind of keep the results on it. And then I will turn this back over to Hassan.
Thank you, Mark, and a great participation. We're approaching 250 participants on this webinar, and great diversity from regions as well as stakeholder community. It is now my pleasure to introduce our distinguished panel for this session. As Mark advances the slide to the panel participants, let me introduce Dr. David Powell, Medical Advisor with IATA, Dr. Ansa Jordan, Chief Medical Aviation Medicine Section with ICAO, and Dr. Paulo Alves, Global Medical Director, Aviation Health with Midair. Welcome, panel. Great to have you on this, and thank you so much for participating. This is a very special panel. And during our last two webinars, we got a number of questions and some discussions about the medical aspects of this crisis and the way forward. So I'll be moderating today. It'll be fairly informal, give and take conversation. What we wanted to do is have 2 or 3 rounds, relating to the major issues. What has happened so far and the impact, some specific aspects, practical issues relating to aviation and flight. And finally, the way forward. What are some of the issues as we get back on track with resumption of flight? So those are some of the conversations. So I thought maybe to start out with, David, we start out maybe with you leading the conversation with some perspectives.
Thank you, Hassan. And just let me check that you're hearing me clearly. Great. Well, thank you for the opportunity to be on the panel. It's the year of the unimaginable, isn't it? And I thought I'd start talking about what might happen if you were one of those people that catches a flight today. Because as many of you know, some flights are still occurring for getting nationals home or for cargo and for other special missions. And who would have thought that it might look something like this, that you get to your airplane to get your flight to your home country, and first of all, you've had to have completed some sort of questionnaire about your current health, or in some cases to provide some certificate as to your wellness. You'll be given a mask to wear before getting to the airplane, have temperature checks most likely, or depending on the location, and arrive to an aircraft which is configured completely differently from normal. Enter an air bridge where you have to be 2 meters, 6 feet away from anybody else as you queue. You enter the aircraft to see the cabin crew all wearing masks and gloves, and not touching your boarding pass, not touching you, keeping their distance from you, and instructing you to board the aircraft according to a specific one-way route, a twin-aisle aircraft that you have to go backwards down one side and then forwards the other to your seat. And reaching your seat, finding that every second one is empty, required to be empty to increase the physical distancing between the passengers. On your seat is a little kit containing some wipes to sterilize your area as required, a biohazard bag, and inside that some materials for cleaning. And your in-flight meal is already in a bag on your seat for you to deal with, so that you don't have to have any interaction with the crew, along with some water, so that again they don't have to serve you. And so it goes on, and hard to imagine that's actually what I've just described as some of the current normal operations for one Western airline today. So it's unimaginable times, and I think to this audience, it's old news, but of course, just over a month ago in Singapore, when IATA had its meeting about how to keep aviation going in the face of the pandemic, the forecast was released about the revenue impact of this outbreak, and that at that stage was $113 billion internationally. Now, the latest forecast just a couple of days ago is 316, representing 55% of revenue globally. And that's the third worst case scenario that's been upgraded, if you will. So just as a perspective, my involvement with the outbreak as medical advisor to IATA began on January 1 on hearing from the WHO and other sources about this outbreak of pneumonia in Wuhan, China. And at that stage, 27 cases were being talked about. That was January 1, and by the end of January, along with ANSA, I was an advisor to the WHO's emergency committee, which was meeting and considering how to respond to that crisis. And it was the 30th when WHO declared this a public health emergency of international concern. And at the time recommended no travel or trade restrictions at all, but a strong public health response. And also cautioned against panic and stigmatization. Within hours, travel and trade restrictions were being introduced thick and fast around the globe, and the process sort of began that has developed to the point where we are now, with many countries effectively with borders closed. And this unimaginable scenario, more than half the airline fleet of the world parked on the ground, airports empty, airlines going broke, people losing jobs. And at this point, only really conceptual ideas about what is the way out of it. Just to paint you a perspective, we were involved in preparing for such an eventuality for a long time. And ever since SARS, there's been collaborations going on to prepare for such an outbreak. In fact, after SARS, we, like the other presenters, I was previously an airline medical officer and involved very much during SARS with the response to the outbreak. And afterwards, we thought, well, that was pretty nasty, but it wasn't terribly contagious. Imagine if it was something much more contagious, like influenza. And we began to think about plans for that. And 6 years later, 2009, we had H1N1. And this seemed to be the terrible event. But of course, as things transpired, even though that was a major influenza outbreak, and many people got sick, the fatality rate was relatively low, just a few hundredths of a %. So after that, we thought, well, imagine if there was something that contagious, but it was more fatal, like SARS. And of course, here we are, really experiencing that nasty combination now. So that really sets the scene about where we are to begin with. My co-presenters are going to talk about some specifics, Paolo, about some particularly focus on the in-flight and pre-flight challenges faced by the outbreak. And then I think Ansa will lead us into the difficult territory of how do we restart aviation in this current environment. But that just sets the scene for you. To mention, if I may, that IATA has a collaboration plan with WHO. So we were already working with them and in touch with them, planning for outbreak scenarios prior to this one occurring. And that collaboration continues along with a number of other international bodies. I think I'll pause there, Hassan, and hand back to you.
Thank you, David. An excellent perspective, historical perspective. How soon we actually forget some of those instances, and I'd like to actually come back in the next round to dive in and some of the challenges there with you. But at this stage, Paolo, going to you, I know you deal with many of these things operationally as you advise the different stakeholders. And I thought maybe just share with us, and in the next round, we're going to get into the practical aspects of it and do a deep dive, but maybe just some observations or remarks.
Sure. Thank you so much, Hassan. Thank you, David. Well, you know, Medair, we have a very privileged window as an observer of what is going on in the industry. What we've been doing, of course, by providing, in-flight support as well as helping the airport agents in their decisions for passengers' fitness to fly, and also in looking to the crew members when they are in their layovers. So we have a very interesting and comprehensive picture, which I'd like to share with you if we could see the first slide. So what we are, and this is actually, we try to do a comparison for the first 14 weeks of the month here and there, for the year, sorry, and how things evolved. And as you can see here, the prevalence of certain symptoms as reported by the flight attendants to us has increased dramatically. And I put the arrows as indicators of number one, when it was the first communication by WHO, and then the second when it was declared a public health emergency of international concern, and the third one when it was declared a pandemic. And you can see, that the oscillations according to the communications. And of course, we don't know if this represents true activity, enhanced or increased awareness, heightened awareness, or both, and most likely both, because you can see here, the individual symptoms, particularly cough. And interestingly enough, on the 14th week, it dropped, maybe because now people are afraid of coughing in public and to be detected in flight. Who knows what is going on, the psychology of this. But this, just to put things in perspective, is how frequent. So 20% of our cases during the 13th week was because someone was coughing in flight. So this gives us a picture of, and again, this was not the case previously, and let alone when we compare with the same period for the past year. On the next slide, you can see how we see this during pre-flight evaluations. And also, so here we combine suspected infectious diseases if the nurse made that as their diagnostic impression, or if they just marked fever, for example, as reported in the pre-flight gate agent or check-in agent, and then they reported to us. And the same thing, you see the fluctuations according to the communications, and the numbers growing, particularly if you compare to 2020 against 2019. So this is, again, this is absolutely remarkable, and keeping in mind that, and I'm not showing here, that as expected from the picture that we already know of the drop in the total number of flights, this is percentual, right? So the percentage of this. So this is a percentage of a very small number of flights. So this is really significant because we are getting less and less calls, but more and more because of suspected infectious diseases concerns. If you look now into the next slide, the position around crew support cases. So, and here, to put things in perspective, those are not proven cases, but just concerned about cases of related to COVID, and in the exact same situation. Sorry, the arrows are a little bit displaced here. So the communication was around the 11th week, and you see the number of cases growing. So back to the in-flight situation, it's interesting because we've been suffering a lot, because in the beginning we had a somehow clear case definition. So for us to identify cases in order to help the crews while in flight, and then to activate an emergency, the health authority for them to control. And of course, as the outbreak evolved, the initial concern about travel history, the need to report possible contacts and not true cases, totally changed, right? Today we are not so depending on the country that you're flying to. Contacts are not, a concern anymore. They are already overwhelmed with true cases. And of course, the travel history is much less important than it was in the beginning. So for us, it was really challenging and sometimes we probably overreacted in activating public health authority and because it was really difficult to harmonize between the requirements from different countries. But just to also another example, so 10% of our cases were actually that we deal with, and I'm saying not 10% of the cases that we had a suspected case in flight, but 10% overall of our cases were we recommended to follow some sort of COVID-19 related protocol, providing the IATA recommendations, isolating the WHO recommendations, isolating the passenger, and providing masks, and crew members using PPEs. So this is in amazing contrast. Just so you know, we didn't have we had 3 diversions of airplanes over the past 3 weeks. This is unheard of. We typically have 3 a day that we helped in managing. So we had actually 2 cases of return to 6 cases of returning to gate, and 2 cases of returning to origination. So I think this provides you know, some food for thought, and I give it back to you, Hassan, and of course we can discuss it further.
No, thank you, Paulo. And these statistics are amazing. And in your role, as you begin to collect this information, you're doing this on a routine basis, basically as part of your role, collecting this information and this data.
Yes, this actually became my life. From a poor cardiologist, now I'm a fake epidemiologist.
Okay. Well, let's just say that this is absolutely important data as we move forward. And so thank you very much for the work that you're doing. Ansa, let me turn it over to you for some perspectives in terms of from ICAO and the good work that you all are doing.
Good afternoon, Hassan. Thank you for inviting me. My colleagues paints a very bleak picture, I'm afraid. And I think we need to not just focus on the negative, but also looking a little bit more at the positive and what has already been implemented and what we are planning to implement more. So yes, we have symptomatic passengers on flights, but like Paulo now has said, 10% of them was what they identified was COVID, needed to be referred for further COVID testing. I do not deny the fact that there will be lots of passengers maybe on board a flight that will have symptoms. I think what we tend to forget is that we already have a lot of mitigation measures in place. For example, in an aircraft, we really don't have sufficient data at the moment to say how many passengers got sick or many crew got sick specifically on the aircraft, because we have specific HEPA filters, we have the measures that we implemented. And at the moment, yes, some states has implemented more measures than we would think we would like to have, and others not enough. So if I can get the slide that I sent you, I would like to tell you what ICAO is doing on this. So if you look at the left, I think it's everybody's left, we have the CAPSCA collaboration in place. So CAPSCA came into being in 2003 when we had the SARS outbreak, and that was, I think, a very good example of the empty aircraft and the empty airports and the things that we're dealing with now, and the same measures that were implemented in a much lower scale, of course. But CAPSCA brings together, and it's a short acronym for a very long word, and I'm not even going to try to get the whole thing right, because I never do. The only thing you need to remember is CAPSCA is the marriage of public health and aviation authorities. And further in the mix, we have various other sectors. So what we're achieving by this is to develop guidance material, to develop procedures, how to deal with a communicable disease in an aviation industry that could impact, that could have a public health impact as well. So for CAPSCA, there is a lot of procedures already available. We use that with all the other outbreaks. We had Ebola, we had Zika. Every time there's an outbreak, we use that. So procedures are there. The way to deal with it is there. We have been upscaling our training. We are developing new guidelines to deal specifically with COVID-19. This is being implemented from a global perspective. It's a joint collaboration mainly with WHO and ICAO, but then we also have lots of UN organizations, other aviation stakeholders, other public health authorities, and it functions at global, regional, national, and even local levels. So what I would like everybody to remember is, if you are not implementing CAPSCA procedures in general, this is really where we need to start. The other thing that both my colleagues talked about is containment at the source of the outbreak. And at the moment, we had a Wuhan shutdown, which actually contributed a lot into flattening the curve. I'm sure you have all heard that term. And what we need to do now is we need to see that we have enough measures in place where we can allow return to flight, because the problem we're experiencing at the moment is there are humanitarian flights that are not happening. There's important medical supplies that are not being taken where they should be taken. So we are implementing from the ICAO perspective. We are working with WHO, CDC, all our other partners and stakeholders, and ICAO will be implementing a public health corridor concept. And this is pretty much a lot of what David described in the beginning. But hopefully, when we have everybody together and we have all the data and we have the way that everybody implements the same procedures, we will see a lessening in lot of some of the procedures that has already been implemented, because some procedures are implemented out of fear or out of perception of what is happening. So we're working very hard to get data that we can work with. And to date, confirmed cases on board an aircraft has been very low. I'm sure there has been cases, and there will be more. We can never have a zero risk, but we need to implement our mitigation measures in line with the risk that exists. And we cannot all just stop flying. We really need to see how we can get back to proper flying, and the way to do that is to look at it from the perspective from where the flight originates. So there's the departure airport, and typically there we will start with an exit screening where you can see this person is safe to board, he doesn't have any symptoms. Then he gets on the flight, and if during the flight he develops symptoms, we have the necessary equipment on board, cabin crew are trained, we have the procedures on how to manage that ill passenger or the ill crew member for that matter. And then we arrive at the arrival airport, and again, if we had a case on board, there's specific procedures to be followed, where to park the aircraft, public health authorities get on board, they do their assessment, do we isolate, do we not isolate? So I think there's a lot of procedures that is in place that has not been properly implemented yet. That's on one hand. And on the other hand, we're dealing with a completely new virus that changes all the time. So we're running around trying to catch up with whatever the virus is doing now. So things are going to change. And the only thing that is certain is things are going to change. But I don't think we should just see the bleak side of it. Right. I think we should just go ahead and say, this is what has worked in the past. We already learned from our past lessons. So now let's work forward and implement new measures.
No, thank you, Hassan. And Mark, can you go back to the CAPSCA chart? I think the work that you're doing, Hassan, as part of CAPSCA, it's very important. It's an important repository of information, and there's significant information coming. from authorities and from various organizations that really CAPSCA is the one-stop shop, if you will, for that information. We at the Flight Safety Foundation are proud to be a member of CAPSCA, and we urge others to certainly help ICAO and CAPSCA to continue with that good information that is so vital for us moving forward. And we will actually come to some of the points you talked about in terms of the way forward. And you touched on some of the areas of concern. And what we'd like to do at this point is actually maybe have our audience participate in that a little bit, Mark, to talk about what they feel might be some of the issues. So maybe at this point we can do some polling.
Yes, we thought it would be interesting to hear from our audience and their perceptions as we think about getting back into business, where passengers might be the most vulnerable to virus transmissions. This polling is a little bit more involved than other polling. You don't just select a particular item. You can rank this in terms of where you think that highest vulnerability is. And you can move these things up and down. And then once you've got it in an order that makes sense for you, you can report your results. And we can see real time as the results come in, what the ranking looks like from our audience.
So panel, I'd like you to just take a look at these results, because I'm going to be asking you about your views on this. And it looks like we are settling in on airport lounges, shops, and restaurants within the airport as number one, number two being the aircraft, number three being security and customs, and then check-in and baggage area. Well, I think we have a tie. But you can see, I think these are all areas of concern, and I would be interested in your expert opinions about these risks. As we're going to do a couple other polls, but we're going to come back to this. So there you have it,
Maybe
Mark.
you can just leave these open for a little while in case there's people that haven't submitted their answers while our panelists speak to their reactions to some of the perceptions.
So, Mark, did you want to do the others and then come back, or do you want to just talk to this with the panel on these?
Well, it looks like nothing's changing much. I thought maybe more people were responding, so I can lock this and we can move on to the other poll.
Okay.
So as we talk about some of the mitigations that might be used when flights resume, we're curious in terms of how effective you think some of the social distancing might be that is either practiced now or might be practiced even more so as things recover. And I'll let that sit up there for just a while, as it looks like a lot of folks are responding.
So it looks
Almost like a, go ahead, Hassan.
No, this is good. It's settling down. It looks like we have opinions across the board. There's certainly concern. We can see with a segment that is concerned about that. The social distancing practices, and will it work? Will it be effective? So again, I'll be coming back to our panel to weigh in on these results and these concerns, because these concerns are going to be the concerns of all passengers trying to get back on the airplane and get back to the airport. So very good. I think you can lock that in, Mark, and we can maybe do one more.
All right. How about wearing face masks for travel?
Yes, I'd like to actually know the answer to this. I will participate very quickly on this poll.
Looks like results are still coming in a little bit.
Very good.
And there is one more if you wanted to do it about temperature scans.
Let's do that, because I think those are all tools and methods that we're going to be seeing when we have resumption of travel. Very good. I think this one, it clearly says that this seems to be one that's going to be important as we begin resumption to have a way in which we can check. So very good, we can lock that in. So panel, there you have it. You had some areas. So maybe I can start off this next round with the practical applications and the practical issues. Paolo, maybe you can start us off with the conversation, and I'd like to, mindful of our time, and I'd like to kind of also have this round before we conclude, but go ahead, Paolo.
Well, I think it's really interesting, the perception, right? Just putting things back into perspective from our experience. And we saw cases coming from airlines from 21 different countries. So we basically got at least one case for every airline we serve here. And the total number of cases that we consider, COVID related in flight, for example, trying to address first the in-flight aspect, was not negligible. It was 228 in this period, remembering that they grew, they increased towards the past, few weeks. So with that said, it's interesting to me that the perception is that it's still high, that the aircraft is a problem, because the elements that we can see are not supporting this, because, for example, we've seen cluster cases in Korea related to churches. We've seen cases related to business meetings in Singapore, in Germany, but we don't have, despite all the cases that we are working here and suspected cases, that is truly associated with a cluster that is associated with a specific flight. So this is my first comment on that. I don't know if David and Ansa would like to chime in as well.
Yes, I'll jump in there for sure. Paulo, I have a contact group amongst about 70 airlines around the world, and there's over 200 people on that group, and I update them every couple of days right through the outbreak. And those 70 airlines represent about 50% of global traffic, and we asked them all to tell us about any instances they were aware of where it was suspected that transmission had occurred in flight. Obviously, many people have flown while incubating and while infected, and we know that for sure. And there's been press reports every now and then, oh yes, this originated in flight. But actually, when we talk to the airlines involved, we only have, from that entire group, which represents hundreds of millions of passenger journeys, about 7 instances, so 3 or possibly 4, which were transmission suspected from passengers to crew members. Mostly cabin crew, one interesting one, a pilot, but so that's passengers to crew, 3 to 4 events. And then there were another 2, which were where one pilot had apparently infected the other pilot. Not known whether that was in flight or on layover. But that's a very small number given the load of passengers over that time. And then just in the last 12 hours, we got information from China about a China Airlines flight from New York to Taipei, in which this is at the end of March. So 12 people subsequently were confirmed as cases, and they actually had symptoms on board the flight, but they hadn't declared them. In the follow-up to that, 326 other passengers have been tested, and at this point 296 results are back from that testing, all of them negative. So that's under current operations with certain protections in place. Of course, I can imagine that masks are being worn amongst that passenger group, but you know, that's also reassuring. Of course, at the moment it's slightly irrelevant, the question, because you can't fly anyway. Even if you thought it was really safe, you're not allowed to go overseas, or even within your own country in many cases, and the events that you would go to are cancelled. So it's there's all of the government challenges that we have to that we have to meet first before we can even get to the point of achieving safe travel. Sorry, long answer.
No, thank you, David. And we're going to need to talk about some of these things, and I'm also mindful of our time. I think we want to transition to maybe the last segment, Mark, in terms of and also we want to certainly do some audience questions as well. But really looking at the future, and I think we've been talking about some of the factors that go into that. What do we need to consider? And so maybe at this point, Mark, did we want to do, or do we have any other polling before I start this segment?
No, we're good on polls right now, Hassan. And so go ahead.
Okay, well, let me start with ANSA. Moving forward, restarting aviation operations, and I know ICAO is doing some tremendous work in terms of global coordination. So maybe you can provide just briefly some perspectives on that as we conclude this segment.
Thank you, Hassan. I think we need to remember how this virus is being transmitted. So at the moment, there's a few reports that it might be airborne, but that hasn't been confirmed, that hasn't been peer reviewed. So basically, the ways it's being transmitted is through droplet spread and also through touch. And the virus lives for has got a different lifespan on different materials. So when we go back to the flying, this is a type of information that we would need to consider. So it was interesting in the poll that, like my colleagues have said, that aircraft is so high on the list, where actually your exposure is much less on the aircraft than in the airport, at customs, or at the baggage claim, because this is where you are closer to other people. That is where you're managing more materials. So, and that's why when you mentioned the collaboration, is we also give guidance and training to the customs people and the check-in and check-out, so the check-in people, all the baggage handlers, all of them get the same training, and this is how you must manage that. Yeah. Temperature screening also for me was a bit not really that effective, because we have not everybody becomes symptomatic. What would be more effective, and that is what we have been doing consistently in any case scenario, not only during this time periods, is when someone is obviously sick, you do not allow him onto the aircraft. So that already goes a long way to protect people from being exposed to any illness, never mind just COVID-19. So for me, the future is really, we need to see what the science tells us. There's a lot of panic out there. There's a lot of information that people believe that has not been confirmed. I'm sure as time goes by, so we're looking at COVID testing, for example. At the moment, the laboratory tests takes 48 hours to get a positive result. They're working on point of care testing. I see that there's one that gives 15 minutes result. I don't know whether that has been approved yet by WHO. Last time I looked, it hasn't. But these are the tools that we will be using going forward. So we might require, well, let's do a point of care test. You'll have your test result within 15 minutes. And if you have the virus, then you might transmit it to somebody. So sorry, we're not going to allow you on the flight.
Very good. No, thank you, Hassan. And that's absolutely on point as we move forward, because there are perceptions and there is the science and there is a conversation around how do we make sure that we continue to provide the right information, the right scientific information, make the decisions based on science moving forward, and continue to educate everybody. We do want to get to audience questions panel. We have a number of those that are being monitored. But before we do that, I just want to just share something with you and get your views. You know, beyond the physiological and medical aspects of COVID-19 that we're discussing, I wanted to highlight concerns about the psychological and the human aspects of this crisis. So I'm sure you all would appreciate, and this enormous emotional toll that is taking across the board. The foundation has tapped into our membership, as well as professionals and experts that deal in this area, to develop a document called An Aviation Professional's Guide to Well-Being relating to these issues. This document is being made available on our website for viewing. It's a short document, but I believe this to be equally important as we move forward with resumption. So I thought just to get any reactions. David?
I think this is a great initiative, and there's something similar being produced by a group called EPSI, which involves the European, both the European Cockpit Association and the Society of Aerospace Medicine there, and they've been keen to emphasize that you know, the challenges from a mental health point of view during the outbreak are considerable, really, to everyone, of course. So the strains on all individuals are being experienced by aircrew as well, but then there's the additional things particular to aviation. So really good to see this initiative. Thanks.
Thank you. Mark, I think at this point, maybe we can just do some audience questions. And I think maybe we can even decide to go over time a little bit with our panel, if you're all willing to stay on for a few more minutes beyond the time allocation. We appreciate that. Mark?
Sure, Hassan. We talked a little bit about face masks as one of the mitigation factors, and there's a question that's coming in regarding face masks. There appears to be mixed advice from various agencies, aviation and other. If passengers are not allowed to board with symptoms, and given the eyes themselves are not covered, I believe another form of entry for the disease are masks. Are they actually effective or necessary?
Who would like to take that on?
Who would like to start?
I can, David can. So face masks, yes, it is effective. There are different types of face masks, which has got different effectiveness and different applications. If we start looking at who needs to wear face masks on board an aircraft, the first question we're going to ask is, who do you want to protect? So if the cabin crew member wears that, it will be a protection for the cabin crew member, but also for the passenger on board if the cabin crew member might have the disease. What we're doing with the public health corridor concept is we are trying to ensure that we have clean crew on board. So we'll try to make sure that they have been tested and that we know that they are or that they're not symptomatic. Face masks, for me personally, I think that is one of the best measures that we can use during these flights because of the way that the virus is being transmitted. It's droplet spread. There's one caveat though, is person must need to know how to wear it. It's no use putting it on incorrectly, fiddling under it, touching there. It's not so easy as it looks. There's a way to wear a face mask.
Understood.
Yeah, let me underline that, Hassan. I think that what Ansa said is critical about who it's going to protect. So early on, a lot of people were wearing masks out in the street to protect themselves from a random encounter with somebody else. And what we know is, and WHO stresses, is that as a protection in that scenario, it's very poor. But in communities where the virus is widespread, and this is now standard in some European countries and being promoted in the US, the chance becomes quite high that somebody is exhaling the virus and they don't know they're even sick. So if you ask everyone to cover their face, and it doesn't need to be a surgical mask, it's just some sort of covering. If you ask everyone to do that, then that greatly reduces the chance of unwitting transmission. And so that's the approach that might be relevant on board, is that you get everyone to wear a mask so that anyone who might be exhaling virus is protecting the chance that they'll be spreading droplets, and that includes the crew. So I agree with what Ansa said. Yeah. The crew wear the mask, that's protecting the passengers. The passenger wear the mask, that's protecting everyone else around them.
No, and that will be very important, David, as we go back to operations, to make sure that we have those standards or guidance or some sort of advisories moving forward. Paolo, I'm sorry.
No. I just wanted to. It is really, in one aspect, this is fascinating. That yes, the masks are useful in a very altruistic manner, right? It's not to protect you; it's to protect the person around you. And this is, to me, is something that we could promote more. Yes, please help. The other one, right, by wearing yourself a mask.
Yeah, Mark. Can we move on to another question? And by the way, Mark, our audience is dedicated. They're staying on, and they will stay on as our wonderful panel, continues to stay on beyond.
Takes a little extra time. Yeah.
Thank you so much.
Somebody's just submitted a question around being skeptical about temp screening. People can easily take a set of minifine. How do we really make sure that temp scanning is going to be effective?
I think Ansa referred to this earlier. It only is effective if somebody has a temperature at that exact time. Even when somebody has a fever, their temperature goes up and down over time anyway. If you take acetaminophen, paracetamol, it will bring it down somewhat. And if you're incubating and not yet sick, then it's not going to detect anything. So it's a very limited measure. But having said that, it did detect a few cases early on in the outbreak on arrival at countries. So it's not completely hopeless. There's also problems about the equipment, about how do you calibrate it, how do you validate it, how do you teach the people how to use it correctly.
And David and panel, I don't think that there is necessarily one tool, but it's really a layered approach to this. As I'm sure you would agree, that as we put that layered approach together and have some sort of a global approach to this, and if we do it consistently, then that would certainly help in the mitigation part of this. Mark, can we move on to another question?
Yeah. Another one comes in saying, as we move towards antibody testing and immunization, could those tests or vaccinations be integrated into passengers information like the old yellow fever vaccination certificates? Could such a thing be integrated into HRs and SARPs?
Can I take this one?
Sure.
I think it is very early days for that, but it is a very valid question. Like I said earlier, the virus is playing games with us. So we have had reports where we thought that people were reinfected, because we all was taught that if you have a disease, you develop the antibodies and then you're immune. We haven't yet seen it with this virus. So we've had reports where people can show antibodies, but they can still be infective even though they have the antibodies. So this is really where we need to look at the science and where we're going to have to decide to do a risk assessment, and balancing what we have to win, what we have to lose, and then decide how we're going to implement that until we have more substantial data and more evidence. If we're lucky, SARS came in 2003 and SARS went and we never saw it again. So coronavirus is also of the same family. So if we're really positive, that's what we can look forward to. If we're not going to have that same scenario, then we might need to end up having something like a yellow fever or like a COVID-19 vaccination certificate or antibody certificate. But still realize that, and it's the same with the measures that we said we need to implement a number of measures. There's no zero risk, and there's no single method that's going to help us prevent transmission of the disease.
Well, thank you so much, Ansa, for that. Mark, our audience is still they're sticking with us. We approached almost 250. We're over 200. Panel, thank you so much for continuing to be with us. So maybe we can take one more, Mark.
Sure. Somebody's interested in where they can get more information on the ICAO Public Health Corridor concept.
Okay. This is exactly what they're saying. It's still a concept. We have been working hard in it within ICAO. We had presentations internally. We had a quick debriefing with our council. We are developing it further. So basically what it involves is, on the one hand, is getting back to normal operations and how we have already amended our procedures to allow for normal operations. I'm not sure if you discussed it last week, but crew couldn't get their medical certificates revalidated because the air medical examiners are busy fighting the disease, or people don't want to go because of the social distancing. So we needed to extend medical certification. The same for pilot licenses, the same for training considerations. So we are working on a comprehensive getting back to service plan. The public health corridor, which will form part of that, is looking, and at the moment we're focusing on emergency humanitarian, that type, medevac type of flights, but it will probably be expanded to normal passenger flights. And what the public health corridor will do is we will start departure flight, what happens at the airport, what happens when you board the flight, what happens during the flight, what happens when you arrive at the airport. And the measures we are looking at is screening measures, procedures on board, procedures during check-in, procedures when you arrive should be segregate certain passengers. So you would typically segregate a stream of passengers if they were on a flight where there was a suspected case on board. They might go to a different waiting area until we know what's going on. And those are the typical CAPSCA procedures that we have implemented for a long time for communicable diseases. So I would like to say that, and this is me, and this is because I'm in medical, but I would like to say that the public health corridor is just an expansion of the CAPSCA concept that we already had. It's just getting a little bit more emphasis now with the COVID-19.
Thank you, Hassan. That's going to be an important concept as we develop that further moving forward. So at this point, I think our segment is coming to a close. Let me just ask Paolo, any other final remarks or thoughts from you?
No, I just want to commend the initiative, and because I think, I mean, in those uncertain times, though, the more we share, the more we learn from each other. So thank you so much for this opportunity.
Thank you, Paolo. And David?
Thanks also. Great to be working with Flight Safety Foundation again, as I have in the past. And it's an exciting time, that's for sure. Nothing, no opportunity for boredom as the picture changes so rapidly. I think there is a way forward. It's not probably going to be very easy. But there is a way forward, and there are lots of opportunities to facilitate the rebuilding of aviation to reconnect the world.
I believe so too. And again, thank you to each of you for participating today. Very informative, very informative, useful information that I'm sure our audience is really appreciating. I look forward to a day very soon that we can actually all meet together. Until that day, I bid you farewell for today. Thank you again, and have a great day. Mark, at this point, I think what we wanted to do is to briefly touch on the upcoming webinar and events.
Yes. Thankfully, there are people in the world that are doing some tremendous work on behalf of those that are in need. And next week, we will talk about humanitarian efforts. It's April 21st. We're back on in the morning on the East Coast here in the US. And we've got folks from the World Food Program, the Red Cross, and some other really wonderful organizations that are helping out in great ways. So hope you can join us then. And then the following week is the original dates of our Business Aviation Safety Seminar, or BAS, and we have turned that into a virtual event. There will be 4 sessions, much like the webinar you saw today, and those 4 sessions will take place, one in the morning, one in the afternoon, on both Wednesday and Thursday, the 29th and 30th of April. We didn't put a slide together on that, but you can visit a lot of the detail on our website at flightsafety.org. So that's what's coming up, and we've got further events in May, and we'll be announcing them pretty soon.
Very good. Thank you, Mark. And let me at this point thank all our audience for participating again today. I know many of you are joining each week, and I hope it's useful to you. Should you have any remarks or comments or improvements that we can do, please forward them to us. We'll be happy to.
I think I'll come back to us
at this point. Okay. And what we would like to do is actually send you a survey, and that survey will help us sort through some of the technical issues, some of the sound issues, as well as some of the content. So thank you very much for participating, and see you again very soon on the next webinar. Have a good day.
It's nearly impossible to predict what will happen in the aftermath of a situation never seen before. As we've seen already, and will continue to see, the response to extraordinary circumstances is extraordinary measures. Therefore, the industry will emerge from the other end something completely new and novel. How deep the dip sinks will be determined by how high the curve soars, and that will be determined by world governments, organizations, and more than all, how every individual out there responds to COVID-19.